Hey guys, welcome back to my channel. Listen, I just came on real quick just to have a little conversation with you guys that's in the healthcare field, that work in nursing homes or assistant living or memory care, and you don't know how to get past, your patients cussing you out. You take it personal, or you don't like them talking to you in that manner. And guys, everybody in this video, none of us like them talking to us like that. Especially, we don't talk to, them in that manner. So we expect them not to talk to us in that manner. But guys, seriously, for me, I do not take it personal when they call me all these derogatory words, when they try to belittle me, when they curse me out and tell me get out their room. Like, that does nothing to me. And in this field, you do have to be strong. Like, you have to have tough skin. And if you allow every little thing that a patient says to you, this is not for you. It's not gonna work. If they curse you out and you ready to curse them out, this is not for you. That stuff should be going over your head. And if anything, if they refusing for you to take care of them, that's less work you have to do. If you in memory care and they're refusing for you to change them, listen, remember, they in memory care. If you leave instead of trying to make them do what you want them to do, if you leave their room and come back 30 minutes to an hour later, they probably already forgot that you came in there before. And you go in and ask again, or you go in and say, "Hi, Miss Smith, I'm here to change your wet or your sore brief." And they might have a totally different personality by the time you get back. You're like, "Oh, come on in." Y'all know how it be working in these nursing homes and stuff. But yeah, don't allow yourself to get mad and frustrated just because, 1 minute they cussing you out, the next minute they nice. Or 1 minute, they cussing you out, then they call their family and start telling their family all types of lies. Like, don't let that stuff get to you. If anything, notify your nurse. If you're a CNA or a med tech, notify your nurse. Your nurse should get up and go and talk to that individual, that patient. If your nurse don't, you probably need to go over their head and talk to your nurse supervisor. And yeah, like, just don't take that stuff to heart. I've been called all types of N words and B words, and honey, it does nothing to me. I just politely leave, and then I go back later. And like I said, I'm not just talking about for memory care. I'm talking about for any patient that's even in their right mind, and they call me all types of words. I'd be like, "Oh, okay. All right, have a good day." I'm still a nice professional because I don't know them on a personal level, and they don't know me on a personal level. So why am I taking it personal? Y'all think about it. So you go to work tomorrow, and one of your patients start cussing you out, trying you, saying all types of stuff, lying on you. Maybe let it roll over your shoulder and go on to the next patient. You can come back to them later. Again, let it roll over your shoulder, go to the next patient, and come back and see them later. Just don't let it get the best of you to the point where you want to quit your job, or, "Oh, I want to change assignments because X, Y, Z." I do agree that at some point, if it never gets better, then yes, you may need to change assignments, meaning, change halls. But yeah, don't carry that stuff home, and don't let it get to the best of you that you got to call your friend and, "Child, this patient just said da 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 da." No, listen, seriously, I got a call like that last night, and I had to tell the CNA, I'm like, "Girl, why you let that bother you? Like, who cares what they say? You know you there to help. You know that you was professional when you in it. Like, so why does it bother you that they're calling you all these words?" Like, don't think that management gonna get involved and be like, "Oh, we gotta ship this patient out." No, baby. Remember, the healthcare field is nothing but the money game. They gonna keep that money. They'll let you go first before they let that patient go, and that's on everything. If you don't believe me, Just watch your facility that you work at, and I know y'all done seen it a time or two, because I know I've seen it. But them patients ain't going nowhere. That's money. We dealing with $1 billion, companies. They got money flowing through. Healthcare is $1 billion industry. So anyways, like I said, I just wanted to come on and just tell y'all, like, be encouraged, pray before you go to work. You can pray while you at work. If it really gets under your skin, again, go tell your nurse and let your nurse know, like, listen, I need a break. Like, give me a 10-15 minute break to calm down or whatever. But y'all don't be quitting your job, and don't let that stuff get under your skin. And if it do, like, maybe this not the field for you. Because again, you have to have tough skin in the healthcare field. If y'all like this type of content, make sure you like, comment, and subscribe. If you had any of these issues at your job in the past, currently, leave a comment below. Tell me your story. And yeah, I'll talk to y'all later. Bye.